When a general anesthetic is administered, the blood pressure tends to go up and down. And what that causes is, on some occasions, increased bleeding during surgery, increased bruising after surgery, and the false notion that all the bleeding is controlled. Then when the patient wakes up, the risk of bleeding afterwards is a little higher because now their blood pressure is elevating, whereas it used to be way too low during the general anesthetic. And when that blood pressure is elevating, then they have more risk of bleeding because the surgeon didn't see it. The surgical team didn't recognize it. How you wake up from the anesthetic is also important. When we wake our patients up from the sedation anesthetic that we use, they generally wake up very peppy. They feel pretty good. When I call to check on you that night, patient picks up the phone themselves and says, "Hey doc, how's it going?" And I ask them questions and I make sure that they are doing well, pain is under control, they're eating properly, and so on. When a general anesthetic is applied, especially in those longer cases like the facelift and neck lift procedures or a revision rhinoplasty, for example, the patient does not have the peppiness that they normally would have with the sedation anesthesia. They just want to lay there. They feel this like intense hangover from the medications that takes several days for them to recover from. And that makes a huge difference in their recovery and how they feel.